Why static air? Because hundreds of years of scientific theories, laws, and principles have proven that flotation therapy works. When a patient lies or sits on a solid or foam surface, the soft tissue trapped between the surface and the bony prominence becomes distorted from the mechanical stresses that are created by unequal pressure and shearing forces. Hooke's law of elasticity addresses how the support surface media and container design determines the stress and strain on the human body. On a solid surface, the distortion of soft tissue at risk causes deficiencies in the blood supply to the tissues, cell distortion, abnormalities in the fluid surrounding the cells, disruption in the flow of the lymphatic system, and often a sudden surge of blood supply and oxygen back to the tissue, reperfusion injury, causing the affected cells to die. When a patient is placed on a static air waffle product, the weight of the body is surrounded by a surface delivering an equal amount of force, following Newton's third law, ideal gas law, and Pascal's principle. The body is supported by flotation, minimizing the distortion of the soft tissue at risk. Archimedes' principle shows that the force on the body in a fluid is equal to the weight of the fluid that the body displaces, similar to an embryo in an amniotic sac. A body on a waffle product is literally floating on air, with unequal pressure and shearing forces on the soft tissue minimized. The calf and heel region of the body is particularly at risk when supported by a solid or foam surface. The soft tissue of the calf becomes distorted, compromising vascular flow to the ankle, foot, and heel complex. This unwanted change in blood flow, along with the skeletal structure and soft tissue of the ankle, foot, and heel complex, creates a serious risk for the development of pressure ulcers on the lower extremities. In Hooke's law, the deformation of an elastic object, in this case the skin and underlying tissue, is proportional to the stress it endures. By placing the calf and foot in a foot waffle, the distortion of the soft tissue at risk is minimized around the bony prominences. The heel complex and Achilles tendon are offloaded from the surface of the bed, and the skeletal structures are protected against foot drop and lateral rotation. When focusing care on what works, going back to basics is always the best practice. Waffle static air products are clinically proven to prevent and help treat pressure ulcers. They have been engineered and fine-tuned for 30 years with clinical input from hundreds of caregivers. Strong products, simple technology, supported by science.